Is medical marijuana safe for someone who suffered a traumatic brain injury? I'm Joe Lamb with Joe Knows Brains, and today we're going to delve into one of the alternative remedies presented far more commonly here in 2022 than even 5-10 years ago, which is medical marijuana as a both short-term and long-term treatment option for people who've suffered from traumatic brain injuries at varying levels. I'm going to start this with the preface that at the moment, there's really not a single pharmacological agent that's demonstrated therapeutic efficacy for resolving brain injuries. There's a lot of trials. That's a really fancy way of saying there doesn't exist a magic drug that can just poof cure your concussion or cure any kind of more serious brain injury. There are many remedies that are being developed at the moment, quite a few concurrently actually. However, at the moment that there isn't anything specific that a doctor can prescribe, even though that's something that, especially with research into the neurometabolic cascade, as that increases, that's something that's becoming more and more of a point of interest for doctors and researchers around the globe. Now, given the recent legalization efforts and the growing popularity of medical cannabis, I thought this was a really interesting topic to cover because many of my clients who've suffered TBI have discussed the idea of using medical cannabis as a treatment option. And in this presentation, I'm going to discuss it from two different perspectives. That's medical marijuana use in what's called the window of efficacy, which would be on the day of an injury, and some of the effects that CBD specifically has that can be protective of the brain. And then I'm also going to discuss kind of the longer term use, and because it's quite common that people may replace pharmaceutical drugs with medical marijuana, it's kind of one of the more common uses of it, and see if that's something that's safe and effective for people who've suffered from TBIs. So really quickly, almost all the research in this area, it's still in preclinical trials. And unfortunately, at least in the United States, development of these trials, it's slowed due to the federal this federal status as a stage 3 narcotic, therefore very much impossible to get research grant funding at a federal level for these researchers who want to see the effects medical cannabis can have. Thankfully, around the world and in certain states where it's legal, that's beginning to change and allowing for some preclinical trials and even some that have gotten further into development. And this is really honestly something interesting because the basic research, or the fledgling research has shown that CBD does have neuroprotective and psychotherapeutic properties. That is to say that it can be beneficial in increasing the active and passive reserve capacity that I talked about in one of my earlier videos, and also in potentially post-injury rehabilitation. Now, again, as I've mentioned, there doesn't yet exist one proven, essentially Tylenol type drug that just poof, your symptoms go away the way that Tylenol would resolve a headache. However, cannabis is so interesting because while on one hand, the CBD properties are being shown to be highly beneficial, it's been widely known for years that consistent and habitual THC use is not the best way to make sure that your brain's functioning at 100% capacity, especially while you're actually engaged in the action of doing it. And really what this comes down to is that a lot of the research is showing that CBD properties and THC properties, well, they both react on what's known as the cannabinoids in the brain. These are receptors in the brain. Many people are familiar with some of the more common receptors in the brain, like dopamine receptors or serotonin receptors. Cannabinoid receptors are a similar situation. They're specific receptors in the brain because certain cannabinoids are actually naturally produced by the body. And I'll talk about a couple of those in a second. But CBD and THC are, of course, the most commonly discussed cannabinoids. And the receptors that they bind to are actually quite different. The THC is what causes that euphoric high sensation that people talk about, commonly associated with consuming marijuana. But CBD is the substance that's becoming more widely known for its therapeutic uses because it doesn't provide any of that same euphoria or high, but at the same time has shown to relieve inflammation and potentially have a lot of other therapeutic uses that are being investigated. So the first area that I want to discuss is that there's the short-term use of cannabis immediately following a brain injury and some of the research that's come out with respect to that. First of all, as I've mentioned previously, a brain injury isn't just a screenshot or a quick flash in the pan like one would break their arm. When you break your arm, the arm's broken. and that's the injury. With the TBI, as I've talked about quite extensively, the injury is more of a process, and the initial blow or the initial cause is more of a catalyst than the actual injury, than being the actual injury itself. So that being said, this results in what's called the neurometabolic cascade. And this cascade is essentially your brain releasing a ton of chemicals, prompting cell death after the initial injury. And some of the more recent research, including this Israeli study, studied an endocannabinoid 2-AG. It's an anti-inflammatory compound. The body naturally produces it following trauma. And they actually found when these researchers administered the greater amounts of 2-AG to mice after a brain injury, they noticed improved motor and cognitive abilities in the following months. Now, that being said, this study is, of course, is very, very preliminary. It's mice. These do not necessarily translate to human studies. And we also don't know what's causing the actual increase. And to be honest, with one study saying something, many people in the scientific community will say, you need to see the experiment be repeated and see the same results again and again to begin to form some kind of theory as to the effect that it's having. Another research showed that CBD reduced seizures, brain edema, and motor skills in newborn pigs following injury. And it's these kinds of studies, these very preliminary studies, that show that potentially use of cannabinoids within the first 24 hours following a TBI could have some neuroprotective effects and reduce that cascade that causes such significant injury. Again, this is all very speculative at this time. This research is very far out from This research is very far out from getting there. And it's just, but it's all showing that as researchers find creative new ways to approach these problems, we may find solutions to injuries that have kind of plagued us for years and years. And we have to always remember that the treatment of brain injuries is not as ancient of a science as the brain injuries are themselves. It's really only been the last 40 years that's seen such a significant increase in the efforts taken to resolve brain injuries and the methods used to treat and help them. Looking at this from a separate perspective, there's been an ongoing struggle to treat TBIs long-term and other injuries with pharmaceuticals. This has prompted many in the medical community to advocate more for medical marijuana because it allows for less adverse liver effects, less adverse effects on the kidney than someone who would, say, take opioids for the rest of their life. Now, that being said, that's all well and good for pain, but how does it affect the brain? And is someone who suffered a TBI, are they more susceptible to the detrimental effects of medical marijuana, or are they more benefited from it? Unfortunately, the long-term research on the implications of medical marijuana use in TBI patients, it's just not quite there yet. And there's very little on the topic. That being said, many individuals choose to treat their ongoing symptoms, especially symptoms such as nausea or headaches, with medical marijuana, and they find various degrees of effect. Now, in terms of the CBD versus THC, the data is just not there to say which one or the other is the better. What it really comes down to is a patient and their prescribing doctor, just like any other methodology to treat an injured or sick person, patient and their doctor getting together, working on a treatment plan and implementing what plan they think is best for long-term effects. Like if someone's got chronic headaches for the rest of their life, there are many ways that they can go about it, and opioids are not always the best route. That being said, to answer the question, generally, medical marijuana is safe for TBI patients to the extent that it is safe for anyone to enjoy or to use marijuana on either, a regular basis or a daily basis. And as more research comes out, both on TBIs and medical marijuana, it's hopeful that maybe this will create some breakthroughs in both fields. And hopefully as more research comes out, it helps people, patients and doctors, understand how to proceed in the best way possible for their brains, for their bodies, for their livers, everything along those lines. As always, if you'd like to learn more about brain injuries, make sure to check out our guide, The Layman's Guide to Brain Injuries. It has a lot of this. It has a lot of information about brain injuries, not as much about medical marijuana, but maybe that'll be added in the future. Thank you guys so much. This is Joe with Joe Knows Brains, and have a great rest of your day.